True NPWT by Medela provides clinicians with options in caring for patients that enhance overall negative pressure wound therapy performance, helping to improve patient outcomes and control costs. Envia Liberty's innovative design delivers excellent versatility with its simple setup and easy operation. Liberty can be used in all care settings, easing patient transition and avoiding extra instruction time. Patients appreciate the ease of use, quiet operation, and compact size of the Liberty. The Envia Motion is a personal negative pressure wound therapy device designed for each patient, offering true NPWT with a full choice of therapy options and promoting improved patient mobility and freedom. True NPWT means offering a choice of either antimicrobial gauze or polyurethane foam dressing kits in a variety of dressing sizes and drain options. Envia gauze dressing kits contain all items required to dress a wound for negative pressure wound therapy, eliminating the need for a clinician to gather additional supplies. This is especially helpful in home care situations where supplies may not be readily available. The Avance foam dressing kits by Molnica Healthcare are available in 3 sizes. Due to the green color, Avance foam allows for easy monitoring of blood and exudates, and the high tensile strength allows minimal fragmenting when cutting to wound size. True NPWT by Medela offers customized wound therapy while enhancing performance, patient comfort, and controlling costs. Avance foam dressing kits come in small, medium, and large sizes. Each kit contains foam, transparent film, and transfer pad. All Avance foam dressing kits can be used with either Envia Liberty or Envia Motion negative pressure wound therapy systems. Be sure to inspect the dressing kit. Do not use if inner package is damaged or open prior to use. Make sure to properly assess, cleanse, and prepare the wound and peri-wound skin prior to proceeding to the dressing application. The wound assessment and preparation chapter in this video provides information on completing these steps. Do not use oxidizing agents such as hypochlorite solutions or hydrogen peroxide prior to the use of the Avance foam dressing. Once the above has been completed, proceed to the next steps. When applicable, protect bones and tendons with a wound contact layer. Document the number of wound contact layers used in the wound. To prepare the wound filler, cut the foam into an appropriate size corresponding to the dimensions of the wound cavity. Be careful not to cut the foam over the wound site, as fragments may fall into the wound. Remove any fragments from the foam edges to protect the wound from loose particles. Cut the foam to sufficiently fill the wound cavity without overpacking. Do not overpack wound filler into any area of the wound, as this could damage tissue, affect exudate removal, or affect delivery of negative pressure. Take care not to overlap wound filler onto intact skin. The next step is to seal the wound with the film dressing. To do this, cut the Avance film dressing to the appropriate size, allowing an overlap of 3 to 5 centimeters onto the surrounding skin. To apply the film dressing over the wound, first expose the adhesive by removing the protective paper at the green bar labeled 1. If the film has been cut, do not remove the protective paper completely. Instead, use it as a grip or handling bar to assist with film application. Apply the film, without stretching, over the wound filler. Stretching the film during application may cause damage to the surrounding skin when negative pressure is applied. Next, remove the remaining end sections of the protective paper to create an airtight seal. Now, remove the transparent carrier or backing film using the green bar labeled number 2. Finally, press and smooth the transparent dressing down firmly around the entire wound for approximately 30 seconds to allow adhesive to seal and ensure a leak-proof wound environment. To apply the transfer pad, cut a hole in the film that is 1 centimeter in diameter. Do not cut a slit or an X. Remove the protective release film from the transfer pad. Consider the preferred direction of the transfer pad tubing in relation to the patient's body and the position of the NPWT device. Center and apply the transfer pad directly over the hole in the film. Press gently to fixate the transfer pad on top of the film. To connect the transfer pad to the NPWT device, Connect the end of the transfer pad drain to the device tubing conical connector, assuring that all of the clamps are open. Initiate negative pressure wound therapy by turning on the NVIA device at the desired physician-ordered settings. Once the negative pressure is applied, the dressing will contract and have a raisin-like appearance. If the dressing does not contract, the system may not be sealed. Inspect the tubing connection and wound dressing for the source of the leak. Reseal with additional Avance film if necessary. Secure the tubing with tape, taking care to avoid placing tubing over bony prominences or pressure-sensitive areas. The recommended dressing change frequency is 3 times a week or as directed by a physician. Maintenance of the NPWT system between dressing changes includes routinely checking that the vacuum level is set as prescribed and that the dressing is properly sealed. Thank you for choosing True NPWT by Medela.